Welcome to the Rim Break Rodeo. We hope this video helps.
You'll start by confirming the bottle is unexpired and sealed, then wash your hands to avoid contamination. Once done, remove the cap and prime the nozzle by squeezing gently until one drop appears. This ensures accurate dosing. Position the bottle so the label faces you and the tip stays sterile on the tissue. You're beginning the application now, so be deliberate. Prime prevents watery underdosing and helps the drop form reliably when you tilt the head back. You'll place the person supine with head slightly tilted back. For infants, cradle the head and support the neck. Next, use your free hand to open the nostril gently, then insert the bottle tip just above the nostril edge. Do not push deep. Squeeze the bottle steadily to release 1-2 drops per nostril as indicated, then pause so solution settles. This method helps the saline reach the nasal passages, loosening mucus without causing discomfort or gag reflex. After application, wait 30 to 60 seconds so the saline can loosen mucus. Then wipe away excess with a tissue and use a bulb syringe if recommended for infants to clear secretions gently. Once finished, recap the bottle to keep the tip sterile and store at room temperature. If symptoms persist or you see irritation or bleeding, stop using the drops and contact a healthcare provider. One key troubleshooting tip: if solution won't dispense, reprime and check for clog.
Thanks for watching. Consider subscribing if we helped you.